So, lastly, and this may be the most important question you answer today, how does the massive weight loss patient choose the right plastic surgeon? After all, while there is rigorous training and requirements for a plastic surgeon to become certified by the American Society of Plastic Surgeons, just as there are for a bariatric surgeon to become certified by the American Society for Metabolic and Bariatric Surgery, there are no rigorous requirements and certification for a subspecialty in bariatric plastic surgery. And as you and I have discussed, there is a big difference between operating on a person who is 150 pounds after they had a couple of babies, and a person who was 150 pounds after they lost 200 pounds. So what is a patient to do?
Well, I think that first of all, the main thing is that they want to make sure that their physician that they're choosing or they're going to see uh, is certified by the American Board of Plastic Surgery. Now, that's probably an entry level type of a degree, so to speak, and also, and that's why I started the American Society of Bariatric Plastic Surgeons, and we have a forum there, Ask a Surgeon, as well as we have members in there. And, even though right now there's no extra qualifications, but at least these particular physicians have identified themselves as, being very much involved in this specialized field and having a special, in other words, not relationship, but I mean basically having what's the word that I want to use? They basically are much more attuned to the requirements of the bariatric patient, plastic surgery patient, so to speak. The other thing is that they can ask their bariatric plastic surgeon, but again, as I mentioned, that may be iffy sometime because there's a too cozy of a relationship sometime between the two. So, I think that the final thing is by asking somebody who's undergone bariatric plastic surgery and who their plastic surgeon was, and also pictures that the patient may see. And then finally also if the comfort level, if they feel comfortable with that particular physician or not. I'd like to just talk a little bit about going overseas and having bariatric plastic surgery because again, all of us or many of us have seen a lot of disasters that we've had to take care of from patients going on overseas having this particular procedures and then coming back. I mean, there's no question that there are qualified and good surgeons in overseas, but the problem is that how is one to know what happens to you and what if something happens to you in those particular areas, and to basically save even a couple of $1,000 in my estimation doesn't really make a lot of sense to me because there are a very variability as far as pricing over here as well as overseas, and basically sometimes I compare the prices that I see that patients have paid overseas, and they're not much more or not much less than what we charge over here. So it really doesn't make a lot of sense to go ahead and jeopardize your well-being and yourself, so to speak, health-wise, safety-wise, by going overseas to have a lot of the surgery. It's better to look at the different options that are available over here. Okay, as far as the insurance is concerned, as far as the financing is concerned, a lot of times if we have, we're asked by the media to basically provide them with patients that they're interested in talking about, and if the patient is willing to talk about their surgeries, we'll give that patient a tremendous discount. Also, university programs will give patients discounts too. So they should look at all those variables rather than jump and go ahead and go overseas and save a couple of $1,000 in order to possibly jeopardize themselves. And I'm not saying that a lot of patients can have a good procedure done overseas. but they just have to think about what they're doing before they leap into going ahead and having it done.
Yeah, I agree. Gosh, I was so scared getting my plastic surgery, and I was with a doctor that I trusted very much. So I could never imagine myself going overseas in a country where I'm not bilingual, so I wouldn't even speak the language. And um, just the risks that um, can happen far out from surgery, so you're there for maybe 2 weeks of recovery, but you can have certainly complications that are well beyond 2 weeks out from surgery. So then what happens? Are you going to fly back there, or are you going to be treated in this country by a plastic surgeon? Well, that plastic surgeon is going to have to treat you as a patient and charge you now, because normally any follow-up visits, if you had a surgery with a plastic surgeon in the United States, those are not extra charges. And if they have to revise you, depending on what that revision is, a lot of surgeons won't charge for that. Some will, some won't. Um, and I agree with you. I have looked at the prices, and I don't see that there's that much of a difference in the cost. And the ones that are greatly reduced, well, I would just really be cautious about that, because I have heard some horror stories that um, I just wouldn't wish upon anyone. And obviously there have been people as well that have had successful surgeries, but I just think that you're taking a big chance and saving only a little bit of money. So it's not for me, and I don't judge anyone who does it. I would just say, though, that if you are a patient considering this, that you really do your due diligence.
And the patients that are on these forums, because a lot of times you'll get the patients telling, oh well, go here to this particular doctor overseas, whatever. The patients should be aware that those particular patients that are saying how great it is are getting a kickback, okay, or getting a commission from that particular doctor, okay,
And that would be illegal in the United States
exactly.
to do, but outside the United States, it's a whole different ball game. Right, right.
And the other thing is that I also have a license in the EU and Italy, and in England as well as Lithuania, and basically the training programs over there, anywhere in the world compared to the U.S. Except obviously in the English type of countries like in Great Britain and Australia, Canada, are much different than they are here. When you're a resident here, you're actually operating. Okay, you're actually doing procedures under the supervision in most cases of a plastic surgeon, one that's gone through the training. In those other countries, including Mexico, all of South America, okay, you're not operating in most cases. You're watching. Okay, you're not even laying hands, so to speak, on the patient. You're assisting, but you're not actually doing the operation. So once they get out of their training, which again they don't have in most cases a certification program as vigorous as we have over here, because we go through not only a written test first of all, and probably 20 to 30% of the patients don't pass, or I'm sorry, physicians that have finished their residency plastic surgery don't pass that, and then after that, after they pass the written portion, we go through an oral exam, okay, and there's probably another 20% that don't pass that. So there's only, I think, 6,000 plastic surgeons throughout the world that are certified by the American Board of Plastic Surgery. So that by itself is the highest standard that you could at least achieve without any further qualifications, from bariatric plastic surgeons. And they don't. These other physicians don't have that, and if they do, as I mentioned, they don't have the the training that we go through, not only to do the operations but also to take care of the problems, which is pretty great. And a lot of times, what happens is that the problems that you get as a complication, or the complication problems, tend to be greater than the operation itself, and they may involve more surgery, okay, as well as more expensive surgery and more prolonged treatment. So it really can be a mess to basically for the patient to save, just some money. You know, I don't see that should be, really. But I mean, obviously, I feel for these patients that don't have the money, and that's why we try to bend over backwards to try to get these procedures covered by, the patients, or try to steer them someplace where they can.
Yeah, I really appreciate that your practice tries to help patients like that. Some private practices, just don't deal with insurance, period. And it opens up a lot more opportunities for a lot more patients to actually get and afford plastic surgery if a practice is willing to, advocate with them, with the insurance companies. Obviously, somebody who is doing this day in and day out as part of their job and who is themselves a medical professional is much more astute at how to deal with insurance companies and how to get things approved versus a patient who probably has never done this before. And it's a stressful situation. So anything that any practice that is willing to help a patient like that is just wonderful. Well, we have had a very valuable discussion, and I'm very appreciative of your generous time today, Dr. Domanskis. Your insights and guidance will certainly help a lot of people. Thank you again, and thank you, listeners. Remember to visit Dr. Domanskis' website, surgery-plastic.com, and my website, mybariatriclife.net, for information and transformative resources. Saying goodbye for now, this is Cheryl Ann Bourne, and I'm living larger than ever. Thank you.
Thank you, Cheryl. Thank you for talking to
Thank you.
me. Okay.